Intermittent Urinary Catheterization by Rachel Hassan, RN. What is intermittent urinary catheterization? It is placing a tube into the bladder or urostomy to remove urine when the child does not have the capacity for controlling bladder emptying. The urethra carries urine from the bladder. The female urethra is about 4 centimeters long. A catheter is inserted through the urethra until it reaches the bladder, and the urine stored in the bladder is then drained from the body through the catheter. In females, the urethra is located right above the vaginal opening. Whereas the female urethra is only 4 centimeters long, the male urethra is approximately 20 centimeters long. Therefore, you will need to insert the catheter in a male a significantly further distance to reach the bladder. What supplies will be needed? A towel, a catheter, a calibrated container to collect the urine in, water-soluble lubricant such as KY jelly or Surgilube. Never use Vaseline. It is a harbor for infection and it will break down the catheter. Liquid soap, water, cleaning agent if one is specified in the orders, paper towels, and gloves. What are the steps of urinary catheterization? Step 1. Ensure that the doctor's orders are clear and in place. These orders should be clear regarding frequency of catheterization, the technique to be used, dressing changes, and site care requirements if needed. The orders should also state whether any urine collected should be recorded. Step 2. Wash your hands thoroughly with soap and water. Next, assemble and prepare the equipment on a clean surface and a paper towel. Make sure that the items are arranged so that you can reach them easily, but that they will not get knocked over. If the orders state that the procedure should be sterile, arrange the items so that the non-sterile items will not be touched after the gloves have been put on. Put on clean gloves. Regular clinic gloves are fine unless the doctor has ordered the use of sterile gloves. Assist the student to a comfortable position so that you may easily access the urethral opening. First, though, make sure that you have arranged for privacy for the student. The student may be lying down or sitting or standing over the toilet. If the student will be lying down, have them lying on their back with their legs in a butterfly position if they're a female, so that you may easily access the urethral opening. Place a towel underneath the child's bottom. If the student will be over the toilet, the male may stand as usual. Have the female spread her legs wide apart so that you may access the urethral opening. Next, locate the urethral opening. In males, make sure to retract the foreskin over the glans penis if needed. In females, open the labial folds. Remember that once your hand has touched the area around the urethra, it is no longer sterile. So if orders require sterile technique, you may not use that hand to touch the catheter or cleaned area. Once you've located the urethral opening, clean the urethral opening and the surrounding area with a clean cotton ball each time you wash the area. Liquid soap and water are sufficient to clean with unless the doctor has ordered a specific cleaning agent. Generously lubricate the tip of the catheter with a water-soluble lubricant, and then make sure that the open end of the catheter is in the container or over the toilet. Make sure that you only use water-soluble lubricants such as KY jelly or Surgilube. Never use non-water-soluble lubricants such as petroleum jelly or Vaseline. If you do not have any water-soluble lubricant available, just use water. Insert the catheter gently into the urethral opening using steady pressure until the muscle relaxes. You should insert the catheter until you feel some resistance. This is the opening to the bladder. Advance the catheter until there is a full stream of urine. Have the student bear down or use the Credes bladder method if needed. You should push slightly past the resistance until you obtain the full stream of urine. If you're having difficulty, the student may bear down as though they're having a bowel movement. If the orders state that you may use a Credes maneuver, you may do that as well. Credes method is when you apply gentle downward pressure on the abdomen just above the bladder. Once the bladder is empty, withdraw the catheter slowly and clamp off the catheter before removing it completely. If a male student is uncircumcised, make sure to pull the foreskin forward over the glans penis after you withdraw the catheter. Help the child to get dressed and then have them return to class. Wash, rinse, and dry the catheter and other materials if they're to be reused, and store them in an appropriate clean container. Use liquid soap and water to wash the catheter and cup and rinse them off with water. Follow the orders if it is specified. Another option is to soak the catheter in a solution of 1 part vinegar and 3 parts water, and then rinse it completely with plain water to remove the solution. Make sure that you store the catheter in an appropriate, clean, dry, sealed container. Measure and record the amount, color, and character of the urine, and dispose of it in the toilet. Is the urine light yellow, dark yellow, orange, red? Is it clear or cloudy? Are there particles floating in the urine? Do you see blood, pus, or mucus in the urine? After you recorded the quality, dispose of your gloves and wash your hands. Next, communicate any signs of infection, inflammation, bleeding, hematoma, tissue damage, or blockage to the school nurse, family, and doctor. Finally, always make sure that you provide privacy for the student. Encourage the student to help with catheterization whenever possible. If physically able, we ultimately want the student to become self-sufficient at catheterizing him or herself. Students who cath frequently have cloudy, foul-smelling, and sometimes bloody urine. However, if it is consistently cloudy, bloody, or foul-smelling, this is a concern. Other concerns include pain during catheterization or in the lower back, burning, pus in the urine, fever, and little or no urine output. Many students who require catheterization have constipation or stool leakage as well. Finally, depending on the student's health condition, his or her urinary anatomy may not have a typical appearance due to surgical alteration. If you have questions about a student or the doctor's orders, always contact the school nurse before doing anything else.